Welcome to BizTech's Health and Wellness Show, presented by IJN, the National Heart Institute of Malaysia. This is a show where we equip you with the knowledge on health and wellness to help you to ensure a more productive life for yourselves, your families, and your employees. I'm Brian Fernandez, and today's conversation is about life after a transplant. Now, to give us different perspectives on this topic, we have Dr. Nur Hidayati Muhammad Sharif, consultant nephrologist, as well as Inche Abdul Rahim, who donated one of his kidneys to his daughter, Nurul Arwa. Now, all of you, thank you very much for coming on the show.
Thank you, Brian.
Thank
I'm happy to be here.
Now, I'm going to start with Dr. Hida first. Dr. Hida, could you give us an overview of the organ donation situation in Malaysia and why organ donation is important?
Okay, as you know, right, we cannot live without any of our body organs. But what happens if one of our organs stop functioning? I mean, like if your heart stop functioning, you'll die. Same also with kidneys. If the kidneys stop functioning, fail, basically it means eventual death if it's not treated. Currently, right, the best option for patients who have kidney failure is actually transplant, where we have another person give up their own kidney either after death or while they are living. So in order for that person who has kidney failure to continue living as normally as they can be. If not, they have to be on dialysis for the rest of their life. And dialysis is not something that is easy to live with.
Yeah, because dialysis not only is it time consuming,
Yes.
it also takes a lot of you from an energy perspective, right?
It's physically and mentally taxing. Imagine that you basically chained to the machine for the rest of your life. You need to be on that machine for definite, I mean like a definite periods of time intermittently every day of every other day, and it will all totally disrupt the way that you live. I mean, if you are someone who are working, who are studying, but at the same time, right, you need to be on this machine to keep you alive. So that's an issue for a lot of young people who suffer from kidney failure.
Okay, and what is the cause normally of kidney failure? What are some of the causes of kidney failure? Yeah.
Okay. For in Malaysia, right, the most common cause is unfortunately is diabetes and hypertension. Two non-communicable chronic diseases that is actually very rampant. I think if you throw a stone out there, right, you will hit someone who with diabetes and hypertension. And for a lot of our patients, because chronic disease can be very with no symptoms initially, so they tend to present late. And by the time that their kidneys already failed, then that's the time that actually presented to a healthcare service. And more often than not, it's already too late. There's not much we can do for it except to continue support through dialysis or work them up for future transplant.
Okay. Now I want to ask, how difficult is the situation in Malaysia in terms of organ donation? How many people are generally on the waiting list, and could you tell us a little bit about why there is a shortage of organ donors?
Okay, in general, right, Malaysia as a country, we have there are currently 23,000 about patients who are aged below 60 years old who currently eligible to be on waiting list for a kidney transplant. But in Malaysia, right, in a year, at most we would be doing about 30 to 50 kidney transplants, either from a deceased donor or a bit more if it's a living donor. So imagine that you have 23,000 patients who had to be on dialysis instead of they can be transplanted and get on with their lives without dialysis.
Well, that's a shocking number. Now, why is there such a shortage of organ donors?
Well, one of the reasons, right, there's a lot of hesitancy for people to actually be organ donors, either
Is there a religious reason for that? In some religions, obviously, that's not encouraged.
uh, okay. To be fair, not all religions are against dialysis, transplant, but there's a lot of misconception that people think that our religion actually discourage donating their kidneys or organs after death. So as I was saying, why we have such a low rate of organ donation? To begin with, we have not many people who are actually willing to donate. Even when a patient, we actually discuss about transplant and we ask if there's anyone in the family would be willing to actually donate, or they, a lot of them, a lot of times that I actually encounter, they would say no, either because they have their own misconception what the effects that would be for the organ donor in the future. I have patients who not willing to donate because they worry that they themselves will be on dialysis later on. So that's why we still need to educate a lot of our Malaysians regarding kidney donation and reassure them that this is a good option for a lot. This is the best option for a lot of patients who are on lifelong dialysis compared to be on dialysis the rest of their life.
Okay, now how can be an organ donor? Is there an age limit? What is a typical profile? Is there people who can't be organ donors?
The way that we actually when we talk about donors, right, there's two types of donors. There's the living donors and there's the disease donors. Disease donors, that means, right, you are donating your kidneys after you pass on.
Okay.
And that for this category of donors, right, there's no age limit. You can sign up even like I mean, obviously you need to be like 18 years and older to be like legally able to actually pledge your organs. We uh, but for living donors, right, in general, we would actually assess on case by case basis, and usually we prefer someone who actually less than 60 years old, not very old, because when you're older, right, your kidneys also have some like impairment due to age-related kidney nephropathy. Um, and also when you are older, you tend to have more chronic diseases like diabetes, hypertension, which make them not very eligible to be a donor itself. When you, if you, for a donor, you need to be someone who's very healthy without any chronic diseases, because our goal is, right, when we do a transplant, right, we need to make sure that our donor is at the best of health they are, you know, to allow them to actually donate their kidney to the recipient.
Okay,
Right?
I want to now switch on to Inche Rahim. Now, Inche Rahim, you donated your kidney to your daughter. Could you tell us about your story and when you did this, when you made the donation?
Okay, Brian, it's all started in 2011, I think. Yes, that's when Nurul was to undergo checkup for her visa to further her study in Australia. So the panel doctor for the Australian High Commission rang me up and called me and said, hey, "Sir, please you come to PJ to discuss about your daughter problem." Then I asked the doctor, "What's the problem? What happened to her?" And then the doctor tell me that something not right, something like disorder in her kidney. So I just drive to PJ and then the doctor and met the doctor. The doctor told me that my daughter suspected to have renal problem, but then the doctor advised me to go to for Adwa to go undergo a biopsy just to verify whether she has really had a kidney problem. So took her back to Johor Bahru and arranged for biopsy, and the doctor in Johor Bahru told me, yes, Adwa was related to IgA nephropathy. Her kidney is malfunctioning, and it's very serious that time. Just about 17%, I think 70% or 27%. I just can't recall what's left for her kidney, and one of her kidney is already damaged. That means it's not reversible. It's not functioning at all. And that time, I asked the doctor, what choice do I have? And then the doctor told me, yes, if my daughter is fit, she can further her study in Australia. But then she has to rely on medicine. And so the doctor there, the Dr. Yudi, I think Dr. Yudi, I just call it, Dr. Yudi told me that IgA nephropathy is irreversible. That means her kidney won't be back to normal unless to undergo for a kidney transplant.
Okay.
But then the doctor said, just to prolong her kidney function, she has to take medicine. Okay, I said it's okay with me. I just follow the advice of the doctor, the physician there, and then the doctor told me, what will you do if you want to have your daughter live a healthy life? And then I said, it's up to, what's your advice? And then the doctor told me, just transplant. Okay, I said, okay, I agree with that. Then the doctor told me, are you a smoker? I said, yes, I'm a smoker. Okay, you rather stop it. You have to be prepared to be a donor. I'm a heavy smoker, so that time it's very hard for me to quit
So you have to
smoking.
stop, lah. Of course, it's for your
Yes, I
daughter,
have to
right?
stop.
So we will do whatever for our daughters, right? So
Yes, I have to. I have no choice. I have no choice. It's quite difficult that time because I'm a field worker, so I stay late at night, and I used to smoke at night just to stay awake. So
okay.
it's very hard decision for me, but I had to try. I had to try it for my daughter's sake. And then doctor just recommend her to further study in Australia. But then in 2011, I got a call from Australia, from Royal Brisbane Hospital. The doctor called me. A doctor called me and told me that my daughter is critical. And said, why? She said, doctor told me he had to put my daughter in ward.
I see.
Yes, and then that's a very hard time for me because I'm working here. My daughter is alone there.
Yes.
But then my daughter tell me just not to inform to my wife, just not inform to her mother, because she don't want my wife to trigger the panic button.
Okay.
You know, yes, mother is always like that. She will just obviously panic. But then I just keep it a secret, and I keep it for 2 weeks. For 2 weeks, my wife didn't notice that her daughter is in ICU. She didn't notice that. She thought my daughter is preparing for her exam. So she was so busy studying. I just told my wife, don't bother your daughter too much. Let her be with her life. Let her have peace with her life. Don't push her too much. That's why I told my wife. But then, unfortunately, the Ministry of Education officers try to ring me, but she can't call me. And then she called my wife, telling my wife that my daughter is in ICU. So that all started when my wife started to panic. It's obvious lah. Mother is always like that. So my daughter is very strong. She's very strong. One I noticed, I failed to notice when she was young. When we have a long journey, a long trip, like from Terengganu to Johor Bahru, she never stopped to eat left. Whereas
Sorry, what? She never stopped to what? Sorry, I didn't hear you.
To eat herself.
Oh, I see.
She never just is something I just failed to notice it. Whereas me, my wife, and my son always when we stop an R&R or whatsoever, we eat ourselves, but not Adwa. She never. Then that is my mistake. I failed to notice it. That is the early symptom for her.
I see. Now I want to ask Nurul now. Nurul, what, and you know, let's take you from the time that your dad just mentioned that you were in ICU. Then what happened then? And then tell us about the transplant that you received from your father.
What happened on that day? What do you mean?
No, so you were in ICU, right, for 2 weeks?
Yeah.
Okay. So what was happening? So you were obviously not conscious of what's happening. So what happened then? You know, tell us about your dad coming over and giving you your kidney and so forth.
Okay, so when I was warded in Australia, and after 2 weeks, the doctor decided me to go for dialysis. Okay, so we do the dialysis immediately there. So my first dialysis was in Australia, and then the university and the Ministry of Education decided for me to go home, to go back to Malaysia for good, because my health was not in a good condition, because they said it might be difficult for me to juggling with my studies and my dialysis schedule. So yeah, so they said it's okay for you to stop now and then you continue later when you are healthy. So when I went home to Malaysia, when I went back to Malaysia, so my dad decided to go for a transplant, to donor his kidney for me. So it was really fast, because we really want me to go back to study as soon as we can, because seeing me on dialysis wasn't good, right? My life during my dialysis, it wasn't really good, and sometimes I feel bad about myself, you know, like, because when I saw my other friends has finished their studies, but I'm still on the dialysis machine doing my regular dialysis, sometimes I really feel down. So when I heard my dad want to donor his kidney to me, I was shocked, and I was worried, and I also feel happy too, because you know, it's like giving me a new hope to my life. So we went for transplant on 2013. So now it's been 8 years of our kidney transplant.
Okay, and how has life been after the transplant?
After the transplant, now it's much better. I would say it's much better. I feel really good about myself, you know, where I can drink as much as I want, as compared to my life during dialysis. You really need to control your water intake, because the dialysis patient really need to control their fluid intake. So after transplant, I can drink whatever I want, coconut juice or whatever. So it's like I was really happy. So I'm enjoying myself now. I would say it's much better, and now I'm really grateful that I can give birth to my daughter.
Congratulations.
Because I heard a dialysis patient would be difficult to give birth, it will be more risk for the dialysis patient as compared to transplant recipient.
Thank you for that, Encik Rahim and Nurul. Now, Dr. Hida, I want to zoom back on you again. So obviously, organ donation is a problem in Malaysia. How do we fix that? Because for someone like me, I filled out a card more than 20 years ago, basically saying that you can take all my organs. However, what's happened since then? I've never got a notification or anything like that. So what happens when you sign up for something like this?
Okay. When you sign up as an organ donor, the first thing that you do after signing up would be telling your family that you have signed up as an organ donor, that you wish to donate your organs after your eventual death. Okay, but for many people, they do sign up, but sometimes they don't tell their family members. So when they died, actually even the family not aware that they actually are organ donors. And this when the doctors who's taking care of the patient are not aware that patient actually already have agreed to be organ donor, so we cannot actually initiate the organ donation process after that person's death. So, and also there are actual situations where the person actually sign up as an organ donor, however the family actually disagree and refuse to allow the organ donation to happen, despite that is that person's wish. So,
Okay. So Dr. Hida, we obviously have a big mismatch here. We have 20, just for kidneys alone, we have 23,000 people on the waiting list, but we only have 30 to 50 transplants a year. Now, in some countries, basically from a legislative standpoint, it is by exception only. So in other words, in some countries, it is your organs are going to be taken by default. If you object, you are supposed to write in and object.
okay.
Do you think that's the right way forward for Malaysia?
There is a lot of discussion regarding policies about opting in or opt out policies on organ donations. Okay, in our country is an opt in. That means
Correct.
someone have to opt to be an organ donor. That only then that we actually allow that person to be donate their organs after death. Unlike other countries, if you need to actually express that you wish to opt out of this universal organ donation process. There's a lot of when I say there's a lot of discussions, that there's a lot of people who from multiple agencies that talk about this, but at the end we are trying to push whether in the future we might switch to that opting out policy. But so far with our current advocacy work, there's not much headway towards that direction. So instead of we pushing for change in policy, we decided that maybe we need to focus more of educating our public regarding opting in as a donor, rather than trying to change the legislation and basically get everyone to donate.
Okay, Dr. Hida, one of the key things that prevents people from donating is the fact that there are a lot of organ donation myths and misinformation.
Yes.
Can you highlight and dispel some of these myths and misinformation?
Okay, for a lot of families, for deceased donor, they thought that when you take out the organs, the deceased body would be. Some people feel that it's sacrilegious.
Oh, okay.
You need to like respect the dead, and we shouldn't. The body should be whole when you bury that person.
Okay, so I'm a completely different kettle of fish. So about 20 over years ago, and I've told my family as well, basically, whatever parts you can use, everything from cornea to heart, liver, whatever, use it because it's going to benefit somebody else. And
But not everyone think that way, Brian.
yes, of course, but we need to educate. We because if the waiting lists are so critical, we really need to go on an education program to ensure that people understand.
The thing with we have actually our religious agencies like our mufti, even the church have actually been involved with our organ donation campaigns. They actually issued fatwa that basically say that organ donation is what we call harus. It's not like forbidden. Basically to reassure like everyone that nothing in any religion is against organ donation. Because basically the spirit of organ donation, right, is sharing
Sharing and giving, exactly.
And I do think that almost all religion practice this and believe in kindness, especially among fellow humans.
Yes.
So I do think, right, we really need to correct this misconception. And there are also people who think that once you sign up with organ donors, right, it basically be like a free for all. The doctors can take all of your organs out and delivering the actual medical care, health that they deserve. They think that, oh, the doctor won't care, won't really treat me because, yeah, I value more if after I die, I'm going to get my organs taken out. No, actually, it doesn't work that way. Most of the time, we only ask whether that person is an organ donor in the event that that person is what we call brain death condition. And usually we don't come to that level until that we already done everything in our power or our arsenal of treatments that to keep that person alive. We only like talk about organ donation after that to families if we feel that patient actually basically is brain death. If you are ill, critically ill, any medical doctors will do whatever they can to actually save you. But we only talk about organization once you reach that category of, we call it brain death.
Okay, Dr. Hida, the other thing that worries a lot of people is the fact that, okay, when I donate my organs, one, there is impairment to my own health, and two, there is in the process of transplantation, the recipient's body rejects the transplant. How have advances in medical technology improved clinical outcomes on both sides, as a donor as well as a recipient?
Okay, Ryan, for anyone who are we planning to do a living related donor like Nurul Adwa and Uncle Rahim here, it entails a lot of workup prior to the transplant itself. And when we talk about workup, right, we basically screen every single thing that can harm the donor, meaning that we will check their their heart, their kidneys, how their function is, what is the function for each of the kidneys. We will screen them for any infectious disease. We will screen them for any, like even their teeth, we will actually screen them. And they will also need to undergo a psychiatric assessment to ensure that they are actually mentally ready to be a donor and really truly want to donate. Don't have hesitation, because we have like a situation where the donor have hesitation or mentally not ready to be to donate. So it's a very thorough procedure to ensure that the only ones who we actually transplant, the donor will have a good life, have the lowest risk possible after the organ donation. Meaning, you look at Uncle Rahim, he's basically right already like more than 60 years old and looking so well.
I know, he looks really good.
Yeah. So but before he had to go for the transplant, right? We had to like optimize his health. It means that he needs to stop smoking. He needs to like optimize his cholesterol level, his blood pressure, his sugar control efficiency. And we try to avoid those who already have chronic diseases, because if they donate, there's the higher chance they as a category of patient, they would actually not a good candidate to donate, because they also have chronic illness, which predispose them to have kidney failure later in life. So these patients, these people we won't be donating. We really we're really strict about this. Only very healthy donors we will proceed with the kidney transplant. And when we do transplant also, right, there's a lot of advances nowadays with immunosuppression. Even patients who actually have different blood group, last time, right, we only can donate if you have same blood group. But now, right, we we call it ABO incompatible transplantation, meaning that you can donate to someone who have a different blood group. Say that I have a blood group O, a blood group B, and you are blood group A. I actually can donate to you, but it needs a lot of preparation and a lot of medication, and it's a bit costlier too. But it is a possible thing. And even in certain countries, right, we actually look at possibility of new technology to preserve the organs longer when we do a cadaveric transplantation. So that would help, so that we can have like someone who is having brain death in, say, Kota Kinabalu, and he happens to be an organ donor, and the team, our procurement team, will actually come to Kota Kinabalu to procure the organ and fly back to KL to actually transplant it to a waiting recipient in, say, our two major Kementerian Kesihatan Malaysia hospital, which is HKL and Selayang, who does kidney transplants.
Now, Dr. Hida, thank you very much for educating us on organ donation, particularly kidney donation. Encik Rahim, thank you very much for sharing your story as well. But we'd like to ask you, Nurul, to share with us any thoughts you would like to share with our audience before we end the show.
Okay, my advice for those who has family who are living the same, like what I did, for example, who are on dialysis. If you are one of their family members, please, please, please donate if you love them, because it's really a life-changing for us to have a new hope in our life when we receive the new kidney. We can undergo a normal life where we don't need to go, when we don't need to really rely on the dialysis machine. Instead, we just need to take care the medicine regularly, instead of doing the dialysis 3 times a week and 3 hours per session. So it's really, really tough for us, the dialysis patients. So if you are one of the family members or friends who has this kinds of person in your life who are undergoing the dialysis, please, 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 I beg you, please donate to them if you really love them.
Thank you very much, Nurul. I'm Brian Fernandez, and we've been speaking to Dr. Nur Hayati Muhammad Sharif, a consultant nephrologist, as well as Encik Abdul Rahim, who donated his kidney to his daughter, Nurul Anwar, on BizTech's Health and Wellness Show, presented by IJN, the National Heart Institute of Malaysia. This video and podcast will be on our social media platforms, as well as our website, www.biztech.asia. Please subscribe and like our various platforms. Thank you very much for tuning in.